Medical experts are urging men to stop delaying medical care. They say delaying treatment has serious consequences. In fact, one of the health non-profit organizations, Right to Care, claims some men avoid going to doctors because they fear being perceived as weak or being stigmatized. To discuss this, we are joined by Dr. Nelson Igaba from Right to Care. Doctor, let's start right there. I mean, a lot of gents don't necessarily come into your patients' rooms, if you will, until it is absolutely late and not much can be done to salvage whatever it is they are experiencing at that moment. Why is that, do you find?
Good morning, William, and good morning to your viewers. Thank you very much for having us on your program. I think you really introduced it quite well there. UNAIDS, in its report on sexuality in 2017, found out that women are more likely to seek healthcare services than men. And it's multifactorial. There are a couple of reasons that could be associated to this. Of course, one is the stigma associated to some illnesses that men do present with, like, sexually transmitted diseases, HIV itself, and other diseases. The other thing is, our African cultures, we men, we perceive ourselves as the strong people, the people who are supposed to always look strong. So, some men feel like, seeking health services, it really makes them look weak. And you find like they delay this and they come to our facilities late. And, William, to even highlight this more, if you look at the statistics, for example, the HIV statistics in South Africa, we are really gearing up to achieving what the UNAIDS call 95, 95, 95. Our country is doing quite well despite the COVID-19 setbacks. We are at, what I mean 95, 95 is like, would like to at least test 95% of people and know their status. And among those who know their status, 95% of them, we should put them on HIV treatment. And those who are on HIV treatment, 95% of them should have no HIV detected in their blood. We are doing well as a country. We are at 95%, 72 and 92. However, when you come and look at the men alone, men are lagging behind. Men are lagging behind. Fewer men, are testing for HIV. And among those who have tested, fewer men are getting started on treatment. And then you have fewer men who have a virus that is controlled. And that is a cause of alarm. Looking at other problems that men also face, you find like among all the people that die in South Africa from the statistic SA data of 2018, men accounted for 57% of that number. And you can really see that many more men are dying than females. Even the number of men who died, of TB accounted for around 53%. So we really need to do something as a country to ensure that men seek healthcare early, they get screened for diseases, and they get the treatment they require.
Doctor, I mean, we know that women are often encouraged to go for things like, I have heard them speak of a pap smear as early on in their teens as possible. What would you suggest men need to go check up on or screen on, just as in right now or this week, today?
Yes, there is a lot that men can do. Let's start with HIV itself. We know that the best way to prevent HIV is by you first knowing your status. And again, I would like to remind men that it begins with you. Your health depends on you. As much as government, non-profit organizations, civil society can do all this much, but at the end of the day, the ball is within the man's court to ensure that he steps up, looks after himself, and in case there's a problem, he seeks health care. We would like to call upon men to know their status, go for an HIV test, and thereafter, if they're HIV negative, ensure they live a less sexual risk lifestyle. And if they're HIV positive, they should be able to start treatment on the same day. If not on the same day, they should start treatment within 14 hours. There are very many other diseases when screened early and treatment initiated early, they can be really treated. including prostate cancer, for example, in men.
Right.
Prostate cancer, any man who is above the age of 40 should be able to screen for prostate cancer, because we have seen that that is quite common in men, especially above the age of 40.
Listen, doctor, thank you
But
so
William,
much.
without forgetting, just one point without forgetting, we are in what South Africans call the circumcision season. So we would like to encourage men to come up and circumcise, because a circumcision, when it's done well and by a medical practitioner, it prevents HIV by 60%. And there are many other benefits to this, including prevention of some sexually transmitted diseases
Sure.
and many others. So Right to Care would like to request men to call this phone number so that they are booked into a health facility and they get a circumcision done by a health practitioner. The phone number is 082-808-6152. When you call this number, a health professional will book you into a facility and you get a circumcision done by a medical practitioner who will follow you up until when you get healed. And it is safe, it is clean, it is of high quality.
Great stuff. Dr. Nelson Igaba, cautionary advice for you as a man watching the South African morning this morning to go for screening, go for your HIV test. In fact, because it is a male circumcision season, he's advising that you call this number 082-808-6152 and conduct your circumcision safely and healthy.